Hi guys, welcome on my YouTube channel. Today topic is generalized anxiety disorder. Initially understand the diagnostic criteria of generalized anxiety disorder according to DSM-5. So let's start. Diagnostic criteria. Criteria A. Excessive anxiety and worry occurring more days than not for at least 6 months, about a number of events or activities. Criteria B. The individual finds it difficult to control the worry. Criteria C. The anxiety and worry are associated with 3 or more of the following 6 symptoms, with at least some symptoms having been present for more days than not for the past 6 months. Only one item is required in children. 1. Restlessness or feeling keyed up or on edge. 2. Being easily fatigued. 3. Difficulty concentrating or mind going blank. 4. Irritability. 5. Muscle tension. 6. Sleep disturbance, difficulty falling or staying asleep, or restless, unsatisfying sleep. Criteria D. The anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Criteria E. The disturbance is not attributable to the physiological effects of a substance or another medical condition. Criteria F. The disturbance is not better explained by another mental disorder. Associated features supporting diagnosis. Associated with muscle tension, there may be trembling, twitching, feeling shaky, and muscle aches or soreness. Many individuals with generalized anxiety disorder also experience somatic symptoms, example, sweating, nausea, diarrhea, and an exaggerated startle response. Symptoms of autonomic hyperarousal, example, accelerated heart rate, shortness of breath, dizziness, are less prominent in generalized anxiety disorder than in other anxiety disorders, such as panic disorder. Other conditions that may be associated with stress, example, irritable bowel syndrome, headaches, frequently accompany generalized anxiety disorder. Risk and prognostic factors. Temperamental. Behavioral inhibition, negative affectivity, neuroticism, and harm avoidance have been associated with generalized anxiety disorder. Environmental. Although childhood adversities and parental overprotection have been associated with generalized anxiety disorder, no environmental factors have been identified as specific to generalized anxiety disorder or necessary or sufficient for making the diagnosis. Genetic and physiological. 1/3 of the risk of experiencing generalized anxiety disorder is genetic, and these genetic factors overlap with the risk of neuroticism and are shared with other anxiety and mood disorders, particularly major depressive disorder. Culture-related diagnostic issues. There is considerable cultural variation in the expression of generalized anxiety disorder. For example, in some cultures, somatic symptoms predominate in the expression of the disorder, whereas in other cultures cognitive symptoms tend to predominate. This difference may be more evident on initial presentation than subsequently, as more symptoms are reported over time. There is no information as to whether the propensity for excessive worrying is related to culture, although the topic being worried about can be culture-specific. It is important to consider the social and cultural context when evaluating whether worries about certain situations are excessive. Gender-related diagnostic issues. In clinical settings, generalized anxiety disorder is diagnosed somewhat more frequently in females than in males. In epidemiological studies, approximately 2/3 are female. Females and males who experience generalized anxiety disorder appear to have similar symptoms, but demonstrate different patterns of comorbidity consistent with gender differences in the prevalence of disorders. In females, comorbidity is largely confined to the anxiety disorders and unipolar depression, whereas in males, comorbidity is more likely to extend to the substance use disorders as well. Functional consequences of generalized anxiety disorder. Excessive worrying impairs the individual's capacity to do things quickly and efficiently, whether at home or at work. The worrying takes time and energy. The associated symptoms of muscle tension and feeling keyed up or on edge, tiredness, difficulty concentrating, and disturbed sleep contribute to the impairment. Importantly, the excessive worrying may impair the ability of individuals with generalized anxiety disorder to encourage confidence in their children. Generalized anxiety disorder is associated with significant disability and distress that is independent of comorbid disorders, and most non-institutionalized adults with the disorder are moderately to seriously disabled. Generalized anxiety disorder accounts for 110 million disability days per annum in the U.S. population. Comorbidity. Individuals whose presentation meets criteria for generalized anxiety disorder are likely to have met, or currently meet, criteria for other anxiety and unipolar depressive disorders. The neuroticism or emotional liability that underpins this pattern of comorbidity is associated with temperamental antecedents and genetic and environmental risk factors shared between these disorders, although independent pathways are also possible. Comorbidity with substance use, conduct, psychotic, neurodevelopmental, and neurocognitive disorders is less common. Thanks for watching. If you consider this video is informative, then like this video and share with your friends, and last thing is subscribe this channel for more informative videos and also click the bell icon for more updates. Thank you.